Hello, everyone. Welcome to the Unconventional Medicine podcast. I'm your host, Dr. Kate Davis, and this is a podcast for those of you who have never listened before, where we really dig into holistic health, how to truly heal at the root cause, really finding those things in our body that are messing up, our gut health. I talk a lot about gut health. That's what I specialize in as a functional medicine doctor. And what's creating brain fog and fatigue and what labs to order every year, what to look at on those labs. So anything and everything holistic medicine, how to create, long-term sustainable health and not end up with chronic diseases later in life. I cover all that in terms of, food quality, non-toxic products, detoxing, all that stuff. So if any of that interests you, you're in the right place. Welcome. And I'm glad you're here. And today we're going to be talking about blood work and labs and the annual blood work that you get every year, why it is almost completely useless and doesn't give you a full picture of what's going on in your body, and all of the different biomarkers that you actually need to see in order to get a really good picture of what's going on in your bodies. We're going to be talking about that today. It's going to be a pretty short episode. I'm just going to hit the highlights today and go over, labs that I want you guys to order every single year. And if they're out of range, how often to order them, what to keep an eye out for, how to get those numbers back down to normal levels, all that stuff. So if that interests you, if you're someone who's been told, for years that, oh, your labs look normal, everything looks great, but you still have fatigue or brain fog or constipation or, loose stool or bloating, there is something else going on. And I just want to give you guys the resources to know how to get the right labs ordered and how to, get your health back on track to a point where you're not having any of those health issues anymore. So I also want to touch on functional ranges versus medical ranges when it comes to blood work, because that is a super important thing to understand, you guys, that most medical ranges basically just tell you if you're in a full-blown disease state or not. There's no gray area. It's just black or white. Are you in a full-blown disease state? Is there cancer? Is there something we can diagnose? Is there something serious going on that we need to treat? But if you fall in that subclinical area, which basically just means you're not in a full-blown disease state, but you still have all these symptoms, all these issues, that is where, medical ranges do not help people. And I've heard so many people who come to me say, all my labs are normal. Everything looks great. That's what the doctors always tell me, but I still feel terrible. I can't sleep. My energy's off. I have brain fog. I can't go to the bathroom every day. I have bloating, look 6 months pregnant after I eat. And it's because there's a lot of markers that are not looked at on blood work, or the ones that you get ordered every year are not looked at from a functional lens and a functional perspective. So I'm going to touch on that today, but in terms of yearly blood work, there are 3 major tests that your doctor is always going to order. So you got the CBC with differential. That's where you see white blood cells, red blood cells. They're looking for infections or, potentially cancer, things like that. Just trying to make sure you're in normal ranges to rule out anything serious and significant. And then you have the metabolic panel, which is going to tell you a lot about electrolytes and kidney function, liver function, all that stuff. So it's going to really give you some insights into how your organs are functioning. But it is a little incomplete, which we're going to touch on in this episode. And then you have the lipid panel, so cholesterol. And that is a much bigger topic. So just know, guys, I'm just going to touch on surface level stuff today. And then I'll, if you guys really like this episode, I'll do some deeper dives into blood chemistry, what to look for on labs, what are normal ranges for some of these markers, things like that. So the first thing I want to touch on, though, is what labs should you add on to your yearly blood work every single year? Because this is really important, you guys. This is the stuff that's going to pick up on if you're on your way to a chronic disease state, if you're on your way to autoimmunity, if you're on your way to, really severe thyroid dysfunction where you're going to need medications the rest of your life. So really, really important that we add this stuff on, that we talk to our doctors, get it added on. You guys, the beauty of this is it doesn't matter if your doctor won't order it nowadays. You can order pretty much any labs on your own, online, and then just go see a functional medicine doctor or a naturopath or an integrative medical doctor, somebody who's really going to look at it from a functional perspective and a functional lens and really help you figure out, what needs to be tweaked, what lifestyle changes you need to make, what dietary changes you might need to start just to, maybe get blood sugar under control or things like that, or to support gallbladder function, lowering your fat intake while we heal the gallbladder and things like that. So you don't get to that point where you have gallstones and have to get your gallbladder removed, or you don't get to that point where you're on Synthroid the rest of your life if you have thyroid dysfunction. So one thing I really think is a huge disservice, especially to women, is that the basic labs, the blood work you get every single year, the only thyroid marker they ever put on that thing is TSH. That tells you practically nothing about thyroid function. There's so many people I've seen who have, normal TSH ranges, even functionally, but if you actually get a deeper look into that thyroid panel, if you get, reverse T3, free T3, free T4, total T3, all that stuff checked out, you'll see that there are some underlying thyroid issues that were never found on your standard blood work. And so this is why it's really important, you guys, to learn how to advocate for yourselves, to go to the doctor and say, hey, look, I'm in my 30s. I'm a woman. I've been noticing, I've been gaining a little more weight. Some common signs of thyroid dysfunction are going to be constipation, depression, weight gain, sleep issues, out of the norm of what you've dealt with your whole life. So if you're having any of those symptoms, advocate for yourself. Tell your doctor, hey, I want a full thyroid panel done. I want to get reverse T, free T3, free T4, total T3. I really want to get a good picture of how my thyroid is functioning because I don't want to, end up with some serious thyroid issue and need a medication forever. So really advocate for yourselves, you guys. There's, if you don't know how to, just research the common symptoms and the history, family history that could indicate that they need to order certain tests, and then just go in and say, hey, look, my mom has thyroid issues or my aunt has thyroid issues. It runs in the family. I just want to make sure I'm good. Can we add this onto the blood work every single year? Most doctors who really care about their patients, who are doing a good job, who understand more of the integrative approach, they're going to do it for you. Now, sometimes your insurance might not cover it, but just know, guys, it's worth getting this stuff done every year. It's going to save you a lot of pain and dysfunction and medical bills later on in life if you can really see how your body is functioning year to year. And you can catch those minor differences, like, oh, my fasting insulin went up the last year. That's interesting. What could be causing that? And then really digging deep with, functional medicine doctor or, a naturopath or an integrative medical doctor who can really just get you on the right path and get those numbers back down to normal before they become full-blown diseases and, chronic issues like cancer or autoimmunity or heart disease, all those things that people are seeing in 50s, 60s, and 70s. You guys, all that stuff starts in your 20s and 30s. So it doesn't happen overnight, which is why it's always really good to get your blood work done every single year. Notice if there are changes in the wrong direction and then start implementing some lifestyle shifts to get those back down to normal. And if you don't know where to start, please work with someone who can help you. It's the easiest, fastest way you're going to get healthier is find someone who can really look at all this blood work, break it down for you, give you some simple things to start with, maybe do some more advanced functional medicine testing to see if there's, a chronic infection or toxin in your body that's causing the liver dysfunction or the gallbladder issues or the leaky gut or anything like that, or the food sensitivities you're getting, to really get a deeper look at what's going on. So full thyroid panel, number one. I mean, it is such a disservice that all they check is TSH on blood work. Like that really irritates me so much. So just know, advocate for yourself. If you're a woman, you should be getting a full thyroid panel done at least every 2 years. If there's nothing wrong, you don't necessarily have to do it every year unless you start noticing some symptoms like I talked about earlier. But bare minimum every 2 years, especially if you hit your 30s and 40s already, you should probably be getting it done every single year. And again, you guys, you can go to all these websites and order this stuff yourself. Now, obviously, you might not know how to read it, and that's okay. Go find someone who can, break it down for you and really kind of dive deep into what exactly is going on in your body. But get this stuff done, every year, especially if you're in your 30s and 40s, because that's when a lot of thyroid stuff kind of pops up on people. So that's number one. Getting anything beyond TSH to show you how your thyroid's functioning. And then number two, one of the biggest things they never include on yearly blood work that also really irritates me because it gives you such a good window into overall metabolic health and risk for chronic disease later in life is fasting insulin. Now, the only time your doctor will typically ever order this test is if they're an integrative doctor and they understand how important it is, or if you have a history of diabetes in your family. So if you're someone who has a history of diabetes in your family, mom, aunt, grandma, whatever, definitely let your doctor know. Just say, hey, there's a history of this in my family. I really want to see how my metabolic health looks. Can I get a fasting insulin test added to that? And what's cool about this is that you can get a good overall indicator of your metabolic health if you use that fasting insulin and the fasting glucose, which is on your yearly blood work, to calculate a number called HOMA-IR. So if you just go to Google, type that in, there's this free calculator you can use. All you need is your fasting insulin and your fasting blood glucose, and it'll tell you your risk of chronic diseases later in life, like heart disease and cancer and, blood clots, things like that. Because you guys, if you have any issues with blood sugar, it basically makes your blood stickier and more likely to clot because you have all this sugar floating around in it. Think about when you add sugar to water. We definitely don't want that. And so that's what A1C kind of shows you on blood work, is kind of how sticky is your blood. But the best indicators for blood sugar and metabolic health are going to be fasting insulin and fasting glucose. They always include fasting glucose on yearly blood work. They rarely ever put fasting insulin. So I have to order it for people because it's never on their blood works. Advocate for this one too, you guys, and just bring up that thing about the HOMA IR. It gives you, I believe it's a 15-year window into the future on your risk of developing diabetes and heart disease and cancer and strokes and all these things that we see in, older populations, like, 60s, 70s, things like that. But we're seeing them a lot in younger people because of our horrible food supply and sedentary lifestyle. So you're seeing it even in 40s and 50-year-olds, which is really sad. So definitely get that one checked. Now, in terms of functional ranges, these are two really important ones I want to talk about. Fasting glucose. If you look at your blood work panel from last year, you're going to notice that it says the normal ranges for blood glucose are up to 99. That is so terrible that they even recommend that for people, because that is basically 100 is you're already in a full-blown metabolic disease state where you're probably going to end up with diabetes if you don't make some drastic changes in your lifestyle. I've had so many people come to me with, their blood sugar at 96, 98, 99, and they're like, oh no, I'm in normal ranges, I'm fine. And I'm like, no, this just means you're not in a full-blown pre-diabetic or diabetic state. This does not mean that you're healthy. You actually want glucose to be below 85. So if you're someone who has 90, 91, 92, you're kind of creeping up on that blood glucose range, definitely want to get that back down to 85 or lower. Now, obviously, we don't want it to go too low. We don't want it below 70 or anything like that. But most people deal with high blood sugar, not low. So that's usually what I focus on. But we want it that 85 or below. So that's what you want to look for on blood work. Just know that they're not going to show it as out of range when you look at your blood work, because that's technically normal medical ranges. And again, back to medical versus functional ranges. If you want to see longevity, long-term health, your risk for getting diseases later on in life, you always want to look at functional ranges. Don't ever rely on medical ones, because once you go over that threshold and you're in a full-blown metabolic dysfunction, it's a lot harder to get yourself back down to normal versus when you just kind of notice like, oh, that's kind of a yellow flag. Maybe I should start, eating protein before sugar or going for multiple walks throughout the day. That's one of the best ways to lower blood sugar and fasting insulin. Multiple 10 to 20 minute walks throughout the day, not just one big walk. So there's actually a lot of research around this, around breaking up those walks into 3 or 4 walks throughout the day. Really, really, really helps bring that blood sugar and insulin back down to normal. And then obviously getting good sleep, lowering stress. There's so many different factors with metabolic health, but those are some of the big ones. And then in terms of insulin, you'll also notice on labs that it will say if your number is 24 or lower, that's normal. Now, if we want good long-term health and we don't want to get cancer, we don't want to get dementia or any other, diseases later on in life, like heart disease and strokes and blood clots, then we actually want that number to be between 2 and 5. So again, you'll notice a lot of these numbers have a huge discrepancy between functional ranges and medical ones. I mean, that's like a 20-point difference. 24 down to 5 is a huge discrepancy. And, again, once you hit 25, you're already in insulin resistance. You're already dealing with metabolic issues. Even if you're above that 5, you're already dealing with some insulin resistance. We just don't want it to get to that point where it really starts to wreak havoc on the body. There is a huge connection between PCOS and insulin resistance, and there's a lot of women who have PCOS nowadays, and a lot of it is just, hey, if we just really focus on bringing this insulin back down, if we really get your metabolic health under control, that can greatly affect symptoms and even get people out of that PCOS state. So a lot of things that it's involved with. So just know, always look at functional ranges. If you don't know functional ranges, that's okay. Luckily with, the internet nowadays, a lot of times you can find pretty good info on there. But again, you guys, if you really want to get someone to really dive deep into your lab work and show you exactly what's going on, with all your organs, your metabolic health, inflammation in your body, please go see a doctor. Go see, I prefer functional medicine doctor or a naturopath. There's a lot of great integrative medical doctors out there now who really do focus on, all aspects of medicine, not just Western. And they do a really great job too. So find someone who's either integrative, functional medicine, or a naturopathic doctor who can really look at this blood work, break it down for you, and give you really easy steps and solutions to get yourself back on the right track. Those are probably my top 3, is getting a full thyroid panel, getting, fasting insulin done, looking at blood sugar from a functional range to really get a good idea of metabolic health and risk of disease later on in life. Because also, when we talk about the cholesterol panel, which we're about to dive into, it really makes a huge difference, you guys, because if you have high cholesterol, and this is a whole rabbit hole that, I would recommend going and finding, these medical doctors who spent 3 hours on one of those bigger podcasts breaking down what cholesterol actually means, what's actually bad, what's actually good, because they do a fantastic job of it. But just know, if you have normal insulin in functional ranges, if you have normal blood sugar in functional ranges, if you have low inflammation, and I'm going to talk about some of those inflammatory markers in a second, it's not really that big of a deal if your cholesterol is a little high, because it's really that oxidation of the cholesterol that causes it to stick to those arteries, and the size of the lipid particles matters. So when you're looking at cholesterol, they just show you a basic panel, right? They show you total cholesterol, triglycerides, LDL, HDL, low density lipoproteins, or very low density lipoproteins. If you have what's quoted as high cholesterol, which for a functional doctor is actually normal, you actually want to be between 200 and 220. And I'm going to read off some stats for you guys, because this blew my mind when I learned it. But there is a lot of research around if your cholesterol is too low, which for women, really, really important to have enough cholesterol because you need it for all of your hormones in your body. But if your cholesterol is actually below 180, you're at risk for a lot of chronic diseases and cancers. So if you're below 180 total cholesterol, you actually have a 200% increase in cerebrovascular accidents like stroke, 300% increase in liver cancer, 200% increase in lung disease, 200% increase in depression and suicide, and a 200% increase in addictive behavior. So you guys, everyone's been taught, good cholesterol, bad cholesterol. Cholesterol has been demonized for so long. And, what they've actually found is that cholesterol is not the issue, it's sugar. And there's a whole big thing, you guys can go look this up, after listening to the podcast, about how back in, the 50s or 60s, the sugar industry actually paid the Heart Association to tell people that fat was bad for them, and that's what was causing heart disease, which was totally false. Totally fraud. It's a high sugar diet that actually drives a lot of this heart disease, which is why you've seen that lowering fat over the last 40 years didn't do anything in terms of bringing down the risk of heart disease and heart attacks and strokes and all this stuff. And so blood sugar is incredibly important when you're thinking about risk of heart disease, risk of stroke, risk of all these chronic diseases I've already mentioned. So just know that if your blood sugar and your insulin are in normal ranges and your cholesterol is at like 215, I'm not super concerned about it. Now, again, always go to a doctor, go to someone, a professional who can really break this down for you and see if there are any other risk factors, because you might have high inflammatory markers, which we're going to dive into as well. And that could be a risk factor as well. It's a very nuanced discussion, but just know LDL is not bad cholesterol. It's just a type of cholesterol that your body actually needs. And it can become bad if it's really, really small in size, because what can happen, and this is where the whole plaquing theory came from, is that, cholesterol slips into the blood vessels, it plaques, and it creates, heart attacks and strokes and all this stuff that we're seeing in people. But if you have high cholesterol, the first thing I want you to do is don't freak out. Don't just jump on a statin. There's a lot of risk factors for neurodegenerative disease later on in life if you're on statins for a long period of time. And that's a whole other the topic. Again, you guys, this is a huge rabbit hole that you could probably spend weeks on, and it'll blow your mind on how we've really been lied to about cholesterol and what all that stuff actually means and the risk factors for it. And jumping on a statin can really, really mess up your neurological health. Huge increase in dementia, Parkinson's, Alzheimer's, all that kind of stuff with people who've been on it for a long term. So that's because your brain is very fatty. You need a lot of fats and cholesterol for proper brain function. And then with women, you need a lot of cholesterol for hormones. So really, really important. Don't just demonize cholesterol. Don't get freaked out if you see it high on your blood work. There's a lot of little nuances to cholesterol that can actually determine if it's good or bad for you. So for example, I had my cholesterol, I think it was 2 or 3 years ago. It was around 220. And of course, the medical doctor I went to get it done with was freaking out, leaving me a voicemail saying, you need to come back in. You have risk factors for all this. But I'd gotten, more detailed testing done, like LP little a, really important, genetic marker for whether or not that high cholesterol can actually become a risk factor for heart disease and strokes. And so getting lipoprotein little a checked, getting a fractionated lipid panel, this is probably going to give you the best window into, is the high cholesterol the good kind, the large particles that cannot slip into the lining of your blood vessels and create clotting and plaques? Or is it the tiny dense particles that actually can slip into the blood vessels and create those plaquing issues in people? So really, really important that if you have high cholesterol, get your doctor to order a fractionated lipid panel. And again, if you have a doctor who won't order this stuff, please go see a naturopath, go see a functional medicine doctor, go see an integrative medical doctor in your area if you can. And just know it's not something to immediately freak out about. Now, obviously, if you have prediabetes or maybe high inflammatory markers in your body, then I would be more concerned. And I'd say, okay, we got to figure out what's causing this. You got to get your cholesterol under control. Just know, guys, that 80% of your cholesterol is produced by the liver. So if you're just trying to do dietary changes to fix your cholesterol, you're probably not going to make that much of a change unless your diet was just absolutely terrible to begin with. If you're eating McDonald's every day of the week, you're absolutely going to notice a difference if you stop doing that, because again, a lot of the stuff that damages our liver and creates some of these cholesterol issues is really toxic food, toxic self-care products. Those really have a huge impact on the liver, especially synthetic fragrances and smells. They can really cause a lot of issues. And because cholesterol is primarily produced in the liver, if you have liver issues, you're going to have cholesterol issues. So that's usually a big marker for me. If I see someone who's fit and healthy and eats really well and they have high cholesterol, I'm usually thinking they've got some liver dysfunction going on. And there's a lot of things that can cause that. You can have chronic infections like parasites or mold toxicity, or you could have toxins in your body like heavy metals or just a ton of synthetic chemicals that you're putting in and on your body every single day. And we might have to clean up the products that you're using and get you on lower tox products to help support the liver function. Lots of different nuances with cholesterol, but just know if it's high, if it's over 200, if it's between 2 and 220, you're probably okay. Now, again, go see a doctor. Make sure there's no other things going on that could predispose you to this. But if it's over that, 200, or if it's even in the 250 to 300 range, get your doctor to order a fractionated lipid panel. That's going to give you a better indicator of if it's a bad type of cholesterol that can, create heart attacks and strokes, or if it's a good, bigger kind of cholesterol that cannot slip into your bloodstream and create those plaques. So really nuanced topic. Always look at other markers. Don't just rely on the basic blood work every year. So again, really, I'm just going to emphasize that while we're on this episode, but don't freak out. Don't just jump on a statin. There's a lot of really, really nasty side effects with statins. Get a deeper look at what is actually causing the cholesterol issue. So again, functionally, obviously, you want to be above 180 because of all those risk factors I listed earlier, but 200 to 220 is typically where you want to be. Cholesterol is good for you, especially as you age. There's actually a lot of research showing that if you're above, I think it was above 50 or 55, you actually want that cholesterol to be a lot higher because it has a lot of protective benefits for your brain. So again, you don't want to just look at cholesterol. You also want to look at blood sugar, fasting insulin, inflammatory markers like HSCRP. Really, really good one. That's the next one we're going to go into. This one, again, never found on standard blood work. Super annoying because it gives you such a good window into total inflammation in your body. And it's also an inflammatory heart marker. So a lot of times they'll use this if you have high cholesterol. They'll usually order, a good doctor will order lipoprotein A, fractionated lipid panel, and they'll also order HSCRP to see if you have systemic inflammation that could predispose you to that cholesterol getting oxidized and sticking to the arteries and creating plaques. And again, you guys, I've seen people too, like someone recently who her cholesterol was, I think in the 270s or 280s. But she did this full body scan of her arteries, 0 plaquing, like none. And her doctor was just so baffled. He's like, I don't know why your cholesterol is so high, but it's not in the arteries. But again, you guys, this is what they're taught in med school. A lot of education in any sort of doctorate program is going to be around 30 years old, 20 years old, just because they don't want to update board exams every year. It was the same in chiropractic school when I went. A lot of the information was really outdated. You had to kind of go shadow doctors and learn from seminars on your own to actually learn how to really help people with like newer, more updated information. So just know, this is what they're taught in med school. A lot of them are doing a great job of like really understanding the nuances of cholesterol nowadays. But just know if you don't find someone who can order this stuff for you, you can always order it yourself online. There is a good website called Life Extension that you can go and order most blood work on there. There are some restrictions with some testing, but again, your best bet, because yes, you can order all this stuff yourself, but if you don't know how to read it, it's going to be kind of useless. So go to a functional medicine doctor, go to a naturopath, go to an integrative medical doctor, get someone who can really look at all this stuff and give you a good idea of what's going on. If you need to go on, if you need to, change some lifestyle stuff, which most of the time that fixes the problem. If you need to do deeper testing to see if there's infections or toxins in your body. If you need to, maybe go on a supplement temporarily for a few months just to really like help regulate blood sugar. or something like that. So really get someone who can kind of break this down for you. It's going to save you a lot of time, a lot of money trying to figure it out yourself. But anyways, back to HSCRP, really, really amazing inflammatory marker in the body. I order this for almost all my patients now because it's really cool for them to see, before and after detoxing. And as their gut is feeling better, they'll see, their CRP levels drop significantly down to normal levels. And I'm like, see, overall inflammation in the body going down. Look at that. And it's just really cool just to because it's cool to see your blood work normalize with whatever protocol you're on, whether it's lifestyle changes or detoxing or, focusing on sleep and stress, things like that. Always have something you're doing and trying out to get your numbers back to normal. And if any of these are way out of range, I want you to get that blood work done every 3 to 4 months until it starts balancing back to normal. Then you can do every 6 months. And if you don't really have any issues with any of them, they're all in functional ranges, just every year, once a year, do all this stuff. But CRP, really, really, really good marker. It's going to tell you, again, your risk for a lot of chronic disease because it's an inflammation marker in the body, especially heart disease. So if you have high cholesterol and your doctor's like, I need you to start taking a statin, and he hasn't ordered a CRP test or a fractionated lipid panel or anything else that could tell him if this is actually really detrimental to your health, go find another doctor. Honestly, if they're not really digging deeper to see, is this, a risk of heart disease later on? Do they actually need this medication? If they're just trying to put you on it immediately, go find someone else. I know it's annoying if you live in a more rural area, but there's a lot of amazing doctors, who do remote work, who work virtually over Zoom. Go find one of them. They'll definitely help you out. So, but CRP, when you look at that one, you want it to be less than 1 to be in pretty good ranges and have very little chances of having chronic inflammatory issues later on in life. So most people are usually in that range. If you want to be in good functional ranges, there's a lot of research around this showing that you actually want to be at 0.3 or below. So really, really important to keep that number as low as possible because we do not want chronic inflammation in the body. Inflammation is the root cause of pretty much every disease process in the body. When things become inflamed, they stop working properly and it creates a cascade of events happening in the body that does not lead to a good outcome. Always get CRP checked, add that to your blood work. That's a really good inflammatory marker. Uric acid is another really good inflammatory marker as well. This one a lot of times is actually included on your yearly blood work, but sometimes they leave it off. I don't really know why. But it is a good inflammatory marker. So optimal ranges functionally for women, you want it to be between 3 and 5.5. And then for men, you want it to be between 3.5 and 5.9. So again, you're going to have elevated uric acid with inflammation in the body. So it's a good inflammatory marker, but also high periods of stress can also raise this one as well. So really important that we get all of these checked. And then another one is going to be GGT. Now, most people have never heard of this one, but I talk a lot about detoxing. If you guys follow me on Instagram, if you've, listened to some of my episodes before, there are 3 main organs that help remove waste products from your body. So one of them is the gut. Then you have a gallbladder, and then you have the liver. Now, on your metabolic panel, you'll have liver enzymes. You'll have a few other markers that can show you some liver dysfunction going on in the body. But just know, don't just rely on your liver enzymes. There's, a lot of studies showing that even people with fatty liver will have normal liver enzymes on blood work. So it's not a complete test for liver health. A lot of times symptoms, really tell me if someone's got some liver dysfunction going on. And then, high toxicity, high infections in the body is going to put a lot of stress on the liver as well. The gallbladder is really important. And this is probably one of the only tests that can actually show you gallbladder function. And because your gallbladder is so important in so many functions in your body, not just fat digestion, you guys don't ever let a doctor remove your gallbladder unless it is absolutely necessary and you're just in excruciating pain in the ER in the middle of the night. That's probably the only time I would ever say, well, you probably got to a point where, it can't really be saved, but just know your body can pass gallstones, as long as they're not too big to block the bile duct, it's not an issue. It's one of the most overused surgeries in the Western world. So just know your gallbladder has so many functions. It helps stimulate bowel movements. It helps fight off infections in your small intestine when it releases bile salts into there. It actually, helps with thyroid function. It helps remove heavy metals from your body. So many different functions. Please, please, please add GGT to your yearly blood work so that you don't get to the point where you have to remove your gallbladder. So this is a really good good one because it's an enzyme that can tell you a lot about if you have gallbladder issues or issues with the bile duct. And so this one can indicate dysfunction outside the liver and inside either the gallbladder or the pancreas. So it can tell you a little bit about more of those digestive organs, a little bit more. And obviously there's other tests you can order for pancreas function, but this is a really good one to see. Do you have some gallbladder issues? Now, obviously, there's a lot of symptoms that can tell me that. Constipation is probably number one. Acid reflux is also another big one I see with gallbladder issues. And people who have clay-colored stool. So if you ever see stool come out that's an off-white color, that is a very huge indicator that your gallbladder is sluggish and not secreting bile salts properly. And we need our body to secrete this stuff because it has so many different functions with digestion and killing off infections like parasites and, bacterial overgrowth and viruses and things like that. So GGT, always get that one added onto your yearly blood work. It'll give you a good idea if your gallbladder is in good health. And optimal ranges for that are between 9 and 30 IUs per liter. And those are basically the ones I wanted to talk about today. So again, just to recap, we want to get fasting insulin. We want to look at functional ranges of fasting glucose and calculate that HOMA-IR number just to make sure you're not at risk for metabolic disease in the future. We want to get HSCRP, uric acid for inflammatory markers. We want to get GGT for, to see if there's a gallbladder issue in the body. And we also want to get a full thyroid panel. So not just TSH, but all the other ones that I mentioned earlier in the episode. So I hope this is helpful for you guys. If you find it really helpful, I can definitely do some more deeper dives later on into lab work and blood work and how to kind of read this stuff and kind of know what's going on in your body. But again, the best thing because it is a lot and it takes a lot to learn all this, the best thing is just going to be to go to one of those online companies. So what's really cool is, yes, you can order your own blood work online now. There are some amazing companies that have hundreds of biomarkers, like way more than all the stuff that I just mentioned during this episode. So one is, I believe it's called Function Health. It's from Dr. Mark Hyman. Yeah, so it's called Function Health. And they have hundreds of biomarkers that they test every single year. This is honestly, you guys, if you want to just get out of the medical system and actually really see what's going on in your body functionally, this is probably the best place to start. It's $365 for the whole year, but they do the testing once a year and it shows hundreds of biomarkers, all that stuff I talked about, like fractionated lipid panel and full thyroid hormone checks and so many other markers. It's going to give you a really, really good idea of if your body needs some support and if it's on track to lead to chronic disease in another 5 to 10 years. And we need to halt that and get it back on track. Or if you're doing healthy and you're doing great, that's awesome. But it's really affordable. Most HSAs and FSAs will actually cover the cost of it. So even if you're like someone who's like, hey, I want to get my insurance to cover most of my blood work, just know if you have an HSA or an FSA fund, they do accept those. And Function is not the only company. There are so many companies coming out now that have this feature where you can pay a one-time yearly fee and they'll order hundreds of biomarkers on blood work to give you a really, really good picture of what's going on internally inside your body. So this is a great place to start. Obviously, if you've got any major health issues going on, again, go find a functional medicine doctor or naturopath who can help you, or an integrative medical doctor, and just, allow them to just look at all this stuff for you and get you back on track. It's going to save you a lot of time, a lot of money, but I hope this was helpful. If you guys have any questions, please let me know. And if you like this episode, if you found a lot of value in it, please, please, please leave me a 5-star review, whether you're on Spotify, Apple Podcasts, whatever, or if you're on YouTube, if you could just hit that subscribe button, like the video, that really helps me out a lot. And I will see you guys on the next episode. And if you're someone who is listening to this and you're like, I don't have anyone in my area who can do this stuff, who can look at this for me, go ahead and check out the show notes. I do work with people remotely, so you can reach out to me. My email address is in the show notes. So you can reach out to me and we can jump on a Zoom call and go over all of your blood work together, and I can really break it down for you and help get you back on the right track. So if that's something you're wanting to do, if you don't have anyone in your area, definitely reach out to me. I'm happy to help. But otherwise, I will see you guys on the next episode. And thanks so much for listening and for joining today.